And right now I'm joined in the studio. It's not every day we get a special guest to join us on the show, but today joined by Dr.Biji George. Doctor, good morning. Well, good afternoon. Thank you for stopping by today. You're a specialist in basically thyroid glands. That's what we're talking about today. You're a general and I knew I'd have problems with that word. Laparoscopic surgeon. There you go.
Yeah,
that's what you specialise in.
Yeah, that's right.
Do you specialise in anything else apart from obviously thyroid glands?
Yeah, but I do almost anything in the abdomen other than doing the spine and brain. Almost anything else I can put a knife to.
Okay, right now laparoscopic. I can say it now.
That's good. That's good. Congratulations.
Thank you. Thyroid glands. I know they're in the neck, but whereabouts are they exactly?
Yeah, on the way here I had a few butterflies in my stomach.
Yeah.
But there is a butterfly in your neck.
I did not know that.
Yeah, that's under your Adam's apple.
Okay.
The thyroid gland is a butterfly-shaped gland in the neck just under the Adam's apple. It produces and stores important hormones.
Okay.
Which regulate the growth, intelligence, calcium metabolism, the heart rate, blood pressure, body temperature, and the rate of metabolism in your body. Can make you fat or thin.
Okay. What about problems with swelling? Because I've heard that you can get severe swelling with the thyroid glands as well.
That's right. There are reasons why it swells up. In growing teenagers, the thyroid can swell up normally, and it is called physiological goiter. It can also be caused because there is not enough iodine in the diet, as we read in our school books all the time. And certain diseases called autoimmune diseases, where our immune system develops antibodies to our own body tissues, can cause thyroid swelling. The two main autoimmune diseases affecting the thyroid are Graves' disease, which leads to an overactive or hypothyroidism, and Hashimoto's disease, where the damaged thyroid is underactive, also called hypothyroidism.
Okay.
Pregnant women also are at risk of having a swollen thyroid due to increased production of a hormone called HCG. And another cause of thyroiditis, is thyroiditis, where the thyroid gland experiences inflammation.
Okay, now you're based at Starcare Hospital in C, which is just up from Muscat City Centre.
That's right, just next to it.
Do you see many people coming in with problems of swelling? Is it very common?
Yeah, it is fairly common because among other than the reasons which I mentioned, there are also other reasons why the thyroid can be swollen up. Mm-hmm. Could I explain further?
Yeah, go ahead, yeah.
And thyroid goiter, which is the thyroid swelling, can also be caused by nodules in the thyroid gland. When there is only a single nodule, it is called solitary nodule of the thyroid, and when there are multiple solid or fluid-filled swellings, it is called multinodular goiter. Both these conditions are often benign, that is non-cancerous. Thyroid cancer is far less common than benign thyroid nodules, and cancer of the thyroid can also present with an enlargement of the thyroid. Mm-hmm. Other medical treatments, like among them the drug amiodarone and the psychiatric drug lithium, can also cause enlargement of the thyroid. And finally, if you had radiation treatments for any reason, like cancer to the neck or chest area, or you've been in a nuclear facility where you've been exposed to radiation, then also you could get enlargement of the thyroid.
I'm glad to say I've not been anywhere near a nuclear facility in the last couple of months, so I'm okay.
I'm okay too. I'm okay too there.
That's good. We're having a chat today with Dr. Biji George at the Starcare Hospital in Muscat. We'll take a break there, Doctor, and we'll come back in a moment. Right now, let's play Britney Spears right here at Merge 104.8.
This kitten got your tongue tied in knots, I see.
Smurge 104.8 and Britney Spears. That is Till the World Ends. The Muscat Drive. It's Neil. Right now 10 to 5. We're having a chat today with Dr. Biji George, general and there you go.
Laparoscopic.
Neil. There you go. Yeah. General and laparoscopic surgeon from Starcare Hospital, right next to City Centre Seeb. How long have you been practicing, by the way? How long have you been in Muscat?
I've been in Muscat for the last 6 months, but I have been practicing for the last 15 years after graduation, post-graduation rather.
Okay. Yep. And you're a specialist in thyroid glands, basically?
Yep, I'm a specialist in thyroid glands. and I treat other diseases as well.
Okay, now I've heard that there can be swelling of the thyroid glands. Do all swellings need operating on?
Not really. If the goiter is small and doesn't cause problems and your thyroid is functioning normally, your doctor may suggest a wait-and-see approach. In hypothyroidism, where there is less hormone production by the thyroid hormone replacement with levothyroxine will resolve the symptoms and may not require surgery. For thyroiditis, your doctor may suggest aspirin or a corticosteroid medication to treat the inflammation. In hyperthyroidism, where the thyroid produces excess hormone, you may need medications to normalize the hormone levels. In some cases, radioactive iodine is used to treat an overactive thyroid gland. The radioactive iodine is taken orally and reaches the thyroid gland through the bloodstream and destroys the thyroid cells.
Mm-hmm. Okay.
You wouldn't like to be radioactive, would you?
No, definitely not. What kind of tests are required to diagnose thyroid swelling?
Basically, there are 5 tests that we normally do to diagnose a thyroid swelling. The first one, a hormone blood test, which determines the amount of hormones produced by the thyroid and also the pituitary gland in the brain, which controls the thyroid. The common tests for the hormone are the hormones T3 and T4, which are produced by the thyroid, and TSH, which is produced by the pituitary gland. Mm-hmm. As we discussed, autoimmune thyroid diseases involve production of abnormal antibodies from our immune system. A blood test may confirm the presence of these antibodies to give us a diagnosis. The next is ultrasound examination of the thyroid, which is a painless and quick test which reveals the size of your thyroid gland and whether the gland contains nodules that I may not be able to have to feel on examination.
Yeah.
The fourth test is called a thyroid scan, where we again have radioactive isotopes injected into a vein, and a special camera produces an image of the thyroid on a computer screen. The thyroid scans are expensive but provide information about the function of the thyroid, and it is also used to monitor treatment of thyroid cancer. And the last test is called a biopsy, also called an FNAB, where we use the ultrasound to guide a very fine needle into the thyroid to obtain tissues or fluid for testing.
What does FNAB stand for? Does it stand for anything in particular?
Yep. FNAB stands for Fine Needle Aspiration Biopsy, where fine needle is a fine needle, and we aspirate some tissues and send it for biopsy.
Okay, there you go. Yeah. Nice and simple, short and sweet. We're talking today with Dr. Biji George from Starcare Hospital. When we come back, we'll take a short break now. We'll come back and we'll talk about some of the surgical treatments for thyroid swellings here at Merge 104.8.
Grams of iodine a day.
Yeah.
But adequate amounts is especially important for pregnancy, lactating women, and infants and children. It's very uncommon, but you can get too much iodine in your diet, and that can sometimes lead to a goiter too. If excess iodine is a problem, then you avoid iodine-fortified salt, shellfish, seaweed, and iodine supplements.
When it comes to surgery, the one thing I think that we're all worried about is complications. Are there any complications when it comes to the surgery?
Yeah, there are complications, but they are fortunately rare, and with expert surgery, they can most often be avoided. The common complications that we come across are basically, number one, the thyroid sits next to a very important nerve in the neck called the recurrent laryngeal nerve, and damage to that can cause loss of voice, and sometimes even that which could be permanent in sometimes if it is completely divided. Mm-hmm. The second complication that we commonly see is bleeding into the place where we have removed the thyroid from, and because that is a very tight area, it can cause breathlessness post-operatively, and it's an urgent situation. The third complication is the loss of calcium, because the thyroid regulates calcium, and removing too much of the thyroid can cause lower calcium in your body, leading to problems. So But as I said, these are rare, and a good surgeon is able to avoid these complications.
Okay, now what happens after surgery? Once the surgery has been done, what happens after that?
Yeah. Basically, as we discussed earlier, the thyroid produces very important hormones, and it's not something that you would remove just for the heck of it, But in certain situations, as I said earlier, where you have to remove the entire thyroid, you have to replace the hormones that the thyroid is producing. And that is done by replacing it with the same hormone that the thyroid produces in a different form, which is called levothyroxine. And this sometimes need to be taken lifelong. And in patients who have low calcium after doing the thyroid surgery, they will need to be on calcium supplements too.
Okay. Are there any tests that we can carry out at home? Maybe if we're stood in front of the mirror, are there any tests that we can look for when it comes to looking for swelling at all?
Yes. The thyroid swellings can be classically diagnosed by the patient themselves by just standing in front of the mirror and swallowing. If you see something moving, which is a projection other than your Adam's apple, right? It moves along with the Adam's apple up and down when you swallow. That is most likely to be the thyroid.
Okay, and then that's when they make an appointment with you?
Yes, and that's when you have to come and see me.
Talking about contact details, if we've got listeners out there who are thinking, actually, yeah, I'd like to have a checkup, I want to get this looked at, the best way to get in contact?
Right. You can meet me in 3 ways. You can come to our website of the Starcare Hospital, which is www.starcarehospital.com, or you can email us at info@starcarehospital.com, or you can call us at 980-88-771.
Okay, and you're taking appointments for new patients as well as existing patients?
Yes, we take appointments, and you can even book online from the site.
Right, okay. So the website again is starcarehospital.com.
That's right.
And the email address is info@starcarehospital.com as well.
That's right.
Yeah, all right, good stuff. Doctor, thank you very much for stopping by today.
Thank you very much, Neil. I really enjoyed this interview. I hope we can do this again sometime.
I'd love to see you again. Come on down again, maybe in a couple of weeks, and come on down and we'll ask you a few more questions. We'll get a bit more of your expert knowledge on the subject as well.
Thank you. I'd enjoy that. Thank you very much, Neil, and thank you to our listeners for listening to this show.
Thank you.
Hi, this is Gary King from Totally 90s.